My name is Dr. Ivor Benjamin. I was privileged to be the co-chair of this conference report, and I also serve as the director of the Cardiovascular Center at the Medical College of Wisconsin. I have the pleasure today of being joined by Dr. Laxmi Mehta, who has a lead author of the paper. Explain to our listeners why clinician well-being has been included in a report focused on professionalism and ethics.
Professionalism in medicine has traditionally been centered around high standards of altruism, the selfless concern for well-being of others in the context of caring for patients. Been increasingly been recognized that clinician well-being is essential to be able to optimally meet patients' needs. Studies have shown that burnout is associated with high rates of medical errors, lower quality of care, and decreased patient satisfaction. And physicians exhibit signs of burnout with increased disruptive behavior and loss of professionalism. So it boils down to simply this: the absence of clinician well-being can negatively affect the accomplishment of patient-centered goals. The Charter on Physician Wellbeing, published in 2018 in JAMA, provides 4 guiding principles. 1, effective patient care promotes and enriches physician well-being. 2, physician well-being is related to the well-being of all members of the healthcare team. 3, physician well-being is a quality marker. And 4, physician well-being is a shared responsibility of all. And I think these make it a good premise to say that we can support our physicians and our clinicians and our researchers if we want to do better care for the entire health system and to improve the quality of outcomes.
You mentioned patient-centered goal, and it probably would be worthwhile for you to drill down in a little bit more detail around the challenges clinicians are facing today.
So in discussions, the task force focused on those inherent challenges that are currently being faced, including consolidation of medical practices, the higher productivity expectations, reduced reimbursements, legislative and regulatory requirements, the explosion of electronic health records, and the exponential growth of clerical burden. So you have all these factors within a rapidly changing healthcare environment, which in many instances increases the burden of work for the clinician to accomplish. This can chip away at clinician well-being and lead to burnout, which is defined as excessive levels of work-related emotional exhaustion, depersonalization, and dissatisfaction with personal accomplishments. Ultimately, the lack of control over your workload, a hectic work environment, and insufficient documentation time are all associated with high rates of burnout.